So how your body basically learns to recognize the antigens that it's on the surface of pathogens and how they develop a specific defense against these particular pathogens. So once you're infected with something and you have your cell-mediated immune response and your humoral immune response active, once the infection is gone and those immune responses shut down, you're left with immunity cell. Oh, sorry, I'm reading the word immunity. You're left with memory cells, which creates a kind of immunity for your body. So immunity is having resistance to a specific pathogen. One way is obviously to get infected with the pathogen and survive the illness that it causes, but a safer, sometimes more effective way is through vaccination, and this happens to be a very important topic at the moment, I think. So a vaccine contains pathogens or toxins that have been changed so that they cannot cause disease. They produce immunity because they contain the antigens that trigger the immune response. And that's what I wanted to stress from the last lesson and also this lesson, is that what causes your body to react are antigens. These are things that your body does not recognize as belonging to yourself. So it's not about the DNA in the virus. It's about the proteins on the surface, which is why we're able to take some harmless viruses and make them look like harmful viruses. So at the end of the day, a vaccine is going to result in producing memory cells, and you have antibodies left over as well. So one of the things that I noticed in the Bangkok Post last week, I don't know if it was you guys or grade 10 I was talking to the other day about new studies show that for the Sinovac virus, virus and vaccines both start with a V. Okay, for the Sinovac vaccine, they have looked at, I think, 1,000 people. I don't know, I have to go back to look at the article. I think it was done just in Thailand. But they looked at the number of antibodies, that people had after they were fully vaccinated, and it turned out that the number of antibodies they had decreased by 50% every 40 days. And that's why in today's paper, there was, I don't remember who it was, but somebody was asking the government to stop buying the Chinese virus. God, the Sinovac, the Chinese Sinovac vaccine, and to try to procure or to get more effective vaccines. There we go. I used the right word. All right. So I'm just going to go through a few diseases that have been controlled or basically almost completely eradicated because of vaccines. Now, polio is a disease that used to wreak havoc on children. One of the better known presidents of the United States, his name was FDR. He was in a wheelchair. He's the guy that said there's nothing to fear but fear itself. He was in a wheelchair because he got polio as a child. And for most, I guess I would say most of the world today, polio doesn't exist because all children are vaccinated against it. So this is the polio virus here. And this is what it does. It basically makes you, it has something to do with the nerves. I can't remember exactly.
The next vaccine prevents a disease that most of us have heard of, but few of us have ever seen. In the 1940s and 1950s, polio routinely paralyzed thousands of children and adults every year. Among them, a president of the United States, Franklin Delano Roosevelt.
FDR.
After an urgent search to find a way to prevent this infection, the first polio vaccine was made by a doctor named Jonas Salk. Dr. Salk made the polio vaccine by purifying poliovirus and then making it harmless by adding a chemical that completely killed the virus. The success of the polio vaccine has been remarkable. No cases of natural polio have occurred in the United States since 1979. And the last case of natural polio in the entire Western Hemisphere occurred in Peru in 1991. Unfortunately, because polio occurs regularly in some parts of the world, it's still important to get the vaccine.
So, so what he's explained in the video, if you didn't catch that, was that basically they took the polio vaccine and, God, what is my problem today? They took the polio virus and they basically killed it using, I don't know what kind of chemical they used, but remember when I said that the DNA or the RNA in the virus doesn't matter, it's about the spike proteins. So if you have a way to deactivate the DNA or RNA of a virus, you can still inject the dead virus and your body will still react. And so I didn't know that there had not been a natural case of polio in the Western, what do you say, the Western Hemisphere since the 1990s. And this because we have vaccines. Another one that really pops up every once in a while, especially in my country where there's this, there was a growing anti-vax population that mostly started with like very liberal people that were like, I want to be all natural and I don't want any chemicals in my kids, blah, 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 is measles. Now, my dad had measles when he was a kid, and it almost killed him. So that is the measles virus, and it basically creates a very, very severe rash, again, in children. And this is why, as children, we always, or most of us, I should say, we get vaccinated. And when I was a kid, and even still now today, I don't know if it's in Thailand. I would be curious if you guys could find out if immunization records are required to go to school, because in America, like when you're entering your kid into like preschool or kindergarten, you have to give the school a record. I guess now people are calling it a vaccine passport. But back in my day, it was just called an immunization record, which just showed that your child had all of the appropriate vaccinations, so you didn't present a danger to the other kids.
So measles is a viral infection that can usually present in a number of ways, but typically we talk about the 3 C's. So cough, coryza, which is runny nose, conjunctivitis or redness of the eyes, fever, and then a rash. The typical rash progression usually starts at the head and works its way down, but that doesn't happen in all cases. Kids can feel quite miserable, like with many other viral infections, but there are some serious complications that can develop as well, including inflammation or swelling in the brain that can leave someone with lasting neurologic or brain damage. It can cause inflammation or swelling in the heart or lungs as well. And so all of these can cause very serious, complicated infections and even lead to death. The biggest myth out there is this link between measles vaccine and autism. This is something that many parents raise to us as their reason for not wanting to vaccinate their children against measles, mumps, and rubella. This is something that comes from a now discredited, retracted study from the late 1990s that came out in the Lancet, has since been retracted from that publication, and all of the co-authors have kind of removed their names from being associated with that paper. But unfortunately, it's kind of really worked its way into the minds of people and has raised this question as to whether there is any link between the MMR vaccine and autism. This has been studied now time and time again, including a large study that came out last week, the largest study done in Denmark, over 600,000 children studied through a population-based registry that again has shown that there is absolutely no link between MMR vaccine and autism. In that study, they also looked at a subgroup of kids who were determined to be at a higher risk of autism, either through risk factors such as having father or mother with advanced age, sibling with autism, and even within that group at increased risk, they did not find any association with MMR vaccine. This is not the first study to show that. We've had multiple other studies. This was the biggest one, and has really given us more data to show that there's absolutely no link there.
So what she was mentioning in that video about in the 1990s, there was a study that came out that supposedly linked this specific vaccine is called the MMR, which stands for measles, mumps, and rubella. It's like a 3-in-1 vaccine, very common for young children. And this study came out in what do you call it? A publication, I think, called The Lancet, and it supposedly linked the MMR vaccine to autism in children. But like she said, it's been discredited. All of the co-authors who basically the authors that wrote with the main author, they have completely taken their name off of that article. The article was retracted by the publication, which meaning like the Lancet, the people that publicized it, they said, okay, no, we take that back. It's not true. There've been study after study that showed that it's just not true. And as she said, there was a big study that was done, even with kids that were at higher risk for autism than average. It's still, there's no link at all. Unfortunately, sometimes things like that, you like, if things start to be talked about, especially in the age of social media. Now, the 1990s, Facebook wasn't around, Twitter wasn't around, Reddit wasn't around, there was no social media at all. So imagine the damage that disinformation and misinformation has these days. So in the 90s, before there was even any social media, you have one study, exactly one study that comes out. Somehow it becomes, I don't know, whatever the version of viral is before social media, but you have all of these people talking about it. And of course, it strikes, especially in parents, a very emotional chord, because this is their children's health that they're talking about. So the reaction becomes very emotional, and it's very hard to kind of try to separate people from their emotions, even when you show them afterwards, like, no, you see, like, the study, it's been debunked, and scientists have done more and more studies, and everyone who wrote the article with the main guy basically took their name off of it, because it turned out that the main scientist who put that study out, he literally cherry picked his data. Like, he had data that didn't support his hypothesis, and he just ignored it. He left it out of the study, which is why it ended up being, like, completely retracted. But unfortunately, even after the truth comes out, like I said, people react emotionally. Like, you see, I don't know if you've seen in Thailand, I know a couple of my Thai friends who just absolutely did not want to get the AstraZeneca vaccine after those stories about the blood clots came out. Even if it was only like 1 out of every 100,000 people might have a reaction. They're like, nope, I'm going to be that one person out of 100,000. I don't want to. It's an emotional reaction, instead of looking at the statistics and be like, statistically, you're going to be just fine. And so that's the problem, especially now when we have social media, when things get put out there so quickly. It doesn't matter, even if it's out there for 12 hours, people start to believe it. And even after you show them the truth, they just won't believe it anymore. They'll think that, that's quote unquote fake news or whatever. And unfortunately, a lot of political leaders all over the world take advantage of that. And so they lie a lot about not just COVID and vaccines and things like that, but they lie to their advantage, because they know that even if they have to retract it, or like walk it back, or say, no, I was mistaken later, it doesn't really matter, because the effect is already there.
One of the most contagious infectious diseases. It can remain suspended in the air for 2 hours after someone with measles has left an area. And so you don't even need to come face to face with someone with measles to catch it. And so that's one of the big reasons why vaccination is so important. You can't kind of control who was in the airspace before you. And so having a good level of immunity to these things is critical to staying protected. Measles is spread through the airborne route, which means you have to inhale the infectious virus. And because it is very tiny droplet nuclei, those can remain suspended in the air for up to 2 hours after someone with measles has left an area. And so that is one of the factors that makes it so contagious and so prone to creating outbreaks when there is a case. It's never too late to get caught up on your vaccines, and your primary care provider is probably the best person to do that, because they'll have any records, if you've even received some in the past, to make sure that you receive everything that you need.
The reason why this is a problem is because over the past few years, there have been in different areas in the United States, like different towns, I guess, or cities, there have been measles outbreaks, because you have this growing population of anti-vax parents that don't get their children vaccinated. And unfortunately, that leads to these small outbreaks of the measles. Now, another disease that's been controlled by vaccination, and it is included in the measles vaccine as well, is another disease called mumps. This is the virus, and you can see it causes swelling in the throat.
Mumps is another viral illness that used to cause a lot of childhood infections across the world that has also decreased substantially since our vaccine programs. We still do see mumps across the world, especially in developing countries, but we've also started to see a resurgence in mumps in the United States. Most people who get mumps get swelling in the neck area. and it causes fever and that sort of illness. And for most people who get mumps, that's the end of it. They get better on their own. Hopefully, they don't spread it to other people. However, there are several complications. This used to be the number one cause of sensorineural hearing loss in children, and can cause infection in the brain and these other things. And this is another situation similar to measles, where we've lost our community memory of what these diseases do. And if one were to go to a developing country and see how children are really affected by these diseases, people can see the value of vaccination and really not take it for granted, as I think we do here.
So what he just said is a really important point in when you have generations of people that have been vaccinated, that over the generations, the new generations, like the younger generations, like kind of forget what having diseases like this in the community, how that affects the community, because you've been protected from it for so long. And it's interesting for me to now start to read a bunch of articles, because obviously I'm like heavily into politics, but I read a lot of articles about what's going on in the US, especially with their COVID numbers. And the COVID numbers are now increasing. I think I mentioned that before. And it's purely because of the unvaccinated people. And there's a lot of stories about people that end up in the hospital from COVID. And they're like, there was one nurse or doctor, I forget, I think it was a doctor, talking about it in an article yesterday that was like, her patients are literally begging her for a vaccine just before she has to ventilate them, which means that they have to put them to sleep and put the tube down their throat so that they're hooked up to a machine that will breathe for them. That's called a ventilator. And they're begging her the vaccine, and she has to just like hold their hand and tell them, I'm sorry, it's too late. A vaccine's not going to help you now. Lots of stories about people that are dying from COVID. But then that kind of affects their family members, and seeing like, when it doesn't affect you personally, it's hard to think of things as being real. But once it actually happens to you personally, or somebody, it makes it a lot more real. And unfortunately for a lot of people all over the world, they don't get it until it personally happens to them, unfortunately. All right, the next disease is called tetanus, and that is the virus. What tetanus does is it ends up making the muscles of your body contract violently, so much so to the point where your own bones can actually break from the tension underneath your muscle contraction.
I have this friend who bikes to work every day, goes hiking in her spare time, and yet, because she's scared of needles, refuses to get a tetanus shot. Here's why that might be a bad idea. I'm Anna Rothschild, and this is Gross Science. Tetanus is caused by the bacterium Clostridium tetani, which lives all around us on things like soil, dust, or rusty nails. When it's in the environment, it exists as something called an endospore, which is a hibernation-like state that can last for decades. But once it enters an oxygen-free place, like say the cut on your elbow when you fall off your bike, it starts to replicate and release toxins. The toxins enter your nervous system, and that's when things take a really bad turn. One of the early symptoms of the disease is lockjaw, essentially muscle spasms that make it difficult to speak or eat. Some patients' faces will freeze into an eerie grin called rhisis sardonicus. And as the disease progresses, other parts of the nervous system become affected as well. It can cause something called opisthotonus, where the back neck muscles spasm, causing the body to contort into an arch and sometimes even breaking bones. Patients can become immobilized and have fevers, difficulty breathing, and heart attacks. With medical care, tetanus is treatable, though recovery can take months, and there's still around a 10% chance of death. Today in America, most of us are vaccinated for tetanus as children, which is probably why there was an average of only 29 cases per year from 2001 to 2008. But the CDC recommends that every 10 years or so, adults re-up their resistance to the disease with a tetanus booster shot. And if the horrifying symptoms I've mentioned so far don't compel you to get your booster, note that the shot also comes with a vaccine for diphtheria and sometimes whooping cough too. So that's a bonus. By the way, whooping cough and tetanus are both extremely dangerous to newborns. So pregnant women are especially encouraged to get vaccinated because they can pass on some level of protection to their babies. Listen, do what you need to do to feel happy and healthy. But if you plan to live an active life and don't get vaccinated, be prepared to accept the possibility of tetanus and the muscle spasms that come with it. You.
Okay, so she had a really good point at the end, talking about newborn babies, because there's what do you call that? A minimum age where vaccines start to be given to young children. So among really young babies, like newborns, I think up to 6 months or even a year, can't remember when vaccinations start. Those babies are too young to be vaccinated. So for a lot of these cases, when you have a family that is against vaccines for some reason, and they don't vaccinate, like say their 6-year-old, and their 6-year-old contracts the measles, their 6-year-old, even though their 6-year-old might just get a little bit sick and then she'll feel fine or he'll feel fine, they can pass it on to their newborn baby sister or brother, and it can actually kill them. So it's really important. Just vaccines are important all around. All right, the last one that I'll talk about is something called diphtheria. This is also caused by a bacteria, and it causes, again, a swelling of the back of the throat. And this is a story from, I think, Syria, somewhere in the Middle East, where it's under, like, it's they're in a war, and so hospitals have a very hard time getting medicines and vaccines.
Now, another aspect of the world's largest humanitarian crisis. It comes through the story of one family that has borne astonishing loss and is trying to prevent even more from the preventable disease diphtheria. And though it's been eradicated in many parts of the world through vaccination, the public health crisis caused by Yemen's war has let this infection flourish there for the first time since 1989. From Aden, special correspondent Beth Murphy reports.
If you could hear Nora, you would hear her screaming. She is just 4 years old, with a tracheostomy tube robbing her of her voice, but giving her life. It's her only way of breathing while suffering from diphtheria. Her 2 siblings, both sisters, have already died of the highly contagious bacterial infection. Now she's in a hospital isolation ward, watched over by her mother and grandmother as she struggles to breathe.
Amira and Sandos are the 2 that died. We are devastated by it. They died with blood coming out of their mouths in their mother's arms. May they rest in peace.
Diphtheria is known as the strangling angel of children. Dr. Alnur Abdularishi explains why.
Is it really like strangling?
Yes, because there is a narrowing in the airway.
That narrowing is caused by a toxin that can also get into the bloodstream and attack the heart, kidneys, and nervous system. That's what killed Nora's younger sister, Amira, who was 3 years old. Ali Masood Muhammad is the nurse who was with her in the ambulance when she died.
Suddenly, she was having seizures and screaming and started convulsing. She was sleeping and then she woke up screaming. This wasn't normal, so I tried to get her to rest. It was cardiac arrest, so I started CPR. I kept performing CPR until 4:30 a.m. I handed the body to the father. I said, "Here is your daughter. I did the best I could and did everything I was able to do and left the rest to God."
Nora's older sister, Sandos, did not survive the surgery to insert a tracheostomy tube in her throat.
I am working here 26 years as a pediatric doctor. I don't facing diphtheria during whole my work, only last year.
It's been nearly 30 years since Yemen's last diphtheria outbreak. The first case in this latest crisis came in August 2017. Since then, the disease has spread to every corner of the country, as the war has made it difficult to inoculate children. and also moved large fleeing populations closer together, where the airborne disease can rapidly spread through coughing and sneezing. 2,600 cases have been counted, but doctors suspect there are countless others that have been misdiagnosed, often as tonsillitis. Doctors here have treated 70 patients. 12 of them died. Nearly all the victims are like Nora, whose families fled fighting in the north. Across Yemen, the healthcare system has collapsed, and there are severe shortages of vaccines, medicines, equipment, and of staff to use it all.
During the war, many health centers stopped to work. There is no vaccination, and also there is migration of the population from one town to another, avoiding the war.
Because the Al Sabaka Hospital here in the southern port city of Aden has received the largest number of diphtheria cases over the past year, doctors here have created training materials that are now being used to teach doctors all across the country how to handle diphtheria cases.
Nora's roommate is 8-year-old Sultan. For 3 weeks, he's been treated with antibiotics and a diphtheria antitoxin. It's a big step to practice talking again. Even with treatment, diphtheria kills 1 out of every 10 patients. Untreated, the death rate is 1 of every 2. With 2 of their 3 children already gone, Nora's family is doing everything they can to keep her alive.
It was traumatic. What could we have done? We didn't know anything about this disease. No cure, nothing. No parent should bury their child. If we'd known about the vaccine, we would have done anything to get it. The disease doesn't know old from young. We will cry for the rest of our lives from the pain we feel from their deaths.
For the PBS NewsHour, I'm Beth Murphy in Aden, Yemen.
Okay, so it wasn't Syria, it was Yemen. Sorry if it's like, I think they're next to each other, but both of those countries have been going through, I think, civil war for several years now, and that has a huge effect. Obviously, not just directly the violence against people in the country, but also just like having huge migrations of people that are leaving certain cities that are under attack and people being closer together. And then when you're closer together, of course, then you're going to have more opportunities for disease outbreaks. And then because it's a war-torn country, you have disruption of like medical supplies and shortage of medical staff. And it's a huge disaster all around. And unfortunately, the people that suffer the most are the kids. Anyway, okay, so that is about vaccines. I'm going to do a short bit that I will upload to GC, just distinguishing between the two COVID-19 vaccines, just so that you guys all understand the science behind that, because I've got about 15 minutes left and I just want to finish this section. So the next topic is allergies. And as I've said before, this is when your immune system reacts to a harmless substance. So it's basically an inappropriate reaction. A lot of different things can cause allergies, like pollen, animal dander, dust mites, food, or even fungal spores. So the symptoms to an allergic reaction is watery eyes, wheezing, which is basically like having problems breathing when you're like, like that. Sneezing, and all of these are results from histamine. So the drugs that you usually take to relieve those symptoms are called antihistamines. This is an allergy test. Basically, what the doctor will do is he will mark off several spots on the skin, and they will usually take a small needle that has been submerged in a particular allergen, or like a substance that causes allergies, and they will do what's called a test scratch. So they will scratch each of those lines with a different allergen, and then where you see these really big swollen parts, which of course you should recognize as being a result of the inflammatory response, these will indicate that these allergens are affecting the patient and not those. Finally, we have autoimmune diseases. Now, the prefix auto means self. So this is when your immune system responds to your body's own cells and attacks them. Usually the lymphocytes that affect your own body cells are destroyed during development. One of the things that I talked about last year were lysosomes, which I can go back to real quick if If you just give me a second to open that, because I just talked about it yesterday. Let me share that screen. Let me go back. Where is it? Lysosomes. Yeah, here we go. If you remember that from last year when I talked about during development and you have certain body parts like your hands and your feet start off basically looking like flippers. And then you have the bone structure, which develops inside that skin. And then you have lysosomes, which come along, or even lymphocytes that contain lysosomes, and they will start to digest the skin around the fingers and the toes so we don't end up with webbed feet. Now, these cells should be destroyed after all of that development is finished. Okay, can't see my mouse. All right, where am I at? Close that. So an autoimmune disease is going to occur when these cells are left over after development. And some examples of autoimmune diseases are lupus, type 1 diabetes, multiple sclerosis, Graves' disease, and rheumatoid arthritis. Remembering from the first unit that I did on the skeletal, muscular, and integumentary system when I talked about arthritis, there's two types of arthritis. One of them is called osteoarthritis. That's a result of just getting old when the cartilage wears down over time between the bones. And so then you get painful swelling joints because it doesn't have that cushion from the cartilage between the joints. Rheumatoid arthritis is an autoimmune disease, and that's when your white blood cells attack the cartilage between your joints. So just a quick FYI about these diseases, because you probably have never heard of most of them. Lupus affects your connective tissue. Symptoms are a facial skin rash, painful joints, fever, and fatigue, which is extreme tiredness. And you also have kidney problems and weight loss. This is a classic lupus rash. Next is type 1 diabetes. Those two types of diabetes, type 2 and type 1. Type 2 diabetes, again, is usually in the aging population. It has a tendency to affect severely obese people. And it is purely a result of diet and health. Type 1 diabetes, again, is an autoimmune disease. So in type 1 diabetes, the white blood cells of the individual attacks the insulin producing cells in an organ called the pancreas. Symptoms of type 1 diabetes is excessive urine production, blurred vision, and again, weight loss and fatigue and irritability. Irritability just being cranky. You have to get a blood test for type 1 diabetes. The next autoimmune disease is multiple sclerosis. This is when your T cells attack the material covering your nerves. Now, we haven't done the nervous system yet, but I always use the analogy of electrical wiring to the nervous system, because your nervous system does the same thing. It carries electrical current. So just like electrical wiring, your nerves need to be covered by an insulator. In the body, this insulator is fat. So it's covered with a layer of lipids. Lipids are nonpolar, so they don't conduct electricity. When your T cells attack this material, it would be the same effect as basically stripping the insulation from electrical wires. And that means you're going to disrupt the flow of electricity through the wires or / through the nerves. So nerve impulses are going to be interrupted. Does anybody recognize this guy? I think he just died a couple of years ago. Yeah, Stephen Hawking. He was considered the smartest man alive, well, I guess until he died, of course. But even when he was at university in Oxford, he was completely normal, and the disease only really started affecting him, I think, in his mid to late 20s. And basically then he just ended up being like, his nerves completely could not communicate with his body at all, to where he was restricted to this wheelchair, and he had this whole special system of talking. And I think maybe he had use of a couple fingers left, and that's how he basically, I don't know, I think there was a whole Discovery Channel thing on like his computer program and how that worked to allow him to talk. Graves' disease attacks the thyroid. The thyroid we'll learn about in the endocrine system, so I doesn't have to really pay too much attention, but it's just examples. Weakness, irritability, heat intolerance, increased sweating, weight loss, and insomnia. This is one of the side effects, is where the eyes kind of bulge out of the face. I'm not really sure why that happens. But anyway, and the last one is rheumatoid arthritis, the same symptoms as osteoarthritis because it attacks the joints. The symptoms are going to be painful and crippling inflammation of the joints. By crippling, I mean like you cannot function. Like that's why, not that's why, but like patients that have this kind of rheumatoid arthritis in their hands are going to have problems just opening a bottle. It's too painful and they don't have the range of movement anymore in their hands. So